Hi and Assalamualaikum everyone. My name is Noor Hannani Syamimi Binti Suffian, and I'm going to present to you my final year project, which my topic is type 2 diabetes patient monitoring system. Okay, first of all, we are going for the problem background of my project. So, as I said the title, my focus in the disease is the type 2 diabetes. Okay, so why I choose that diabetes is because first, diabetes mellitus is a significant public health issue. So 1 in 5 adults in Malaysia is affected by the diabetes. So and also the socio-economic and cultural factors influence this poor diabetes management, especially particularly among the elderly in Malaysia. So elderly and rural population are particularly affected due to the limited and understanding of this disease. And then why I focus in elderly in Malaysia is because the elderly often lack access to advanced healthcare technologies. So this cause worsening the problem. Okay, next we are going for the problem statement. Okay, so first, many elderly individuals in Malaysia face inadequate diabetes education and socio-economic barrier, hindering their ability to manage diabetes effectively. So second, okay, how can SMS technology be utilized to improve diabetes management for the elderly population in Malaysia, who may have limited access to and familiarity with advanced technology? So as I said, I will be using SMS system in solving this matter. Okay, so third, can a simple SMS-based intervention bridge the gap in diabetes self-management, education and support, thereby reducing the incidence of diabetes-related complication for elderly patients? Okay, next is the project goal. So what is my project goal is to bridge the gap in technological accessibility using short message service technology to improve the accessibility and effectiveness of diabetes care for the elderly population in Malaysia. My project objective, I have 3. First is to bridge the gap in technological accessibility using short message service. So you may wondering, how do I bridge the gap in technological accessibility using SMS? And why I'm choosing SMS service is because first, SMS is they are simplicity and ubiquity. So first, SMS is a widely available technology that does not require smartphone or internet access, making it accessible to broad range of users, including the elderly who may not be familiar with modern smartphone or internet-based application. And also, SMS is supported by all mobile phone. Okay, and then unlike mobile apps or any web-based technology, okay, SMS does not require the user to learn how to navigate complex interface. So the elderly can receive and send SMS with minimal instruction. Okay, so this will making SMS as a suitable medium for those who may not be tech savvy. Okay, and then last is cost effective. SMS is a cost effective solution for both healthcare provider and also the patient itself. Sending SMS is not expensive and there are no additional costs beyond basic mobile phone charges. Okay. Next, we are going for the project scope. Okay, so this project will focus on developing the type 2 diabetes patient monitoring system, so by using SMS. So the technology that I'll be implemented in this project is Python, and then I'll be using Vonage for the SMS gateway provider, and then for the database management system is MySQL. Right, so next we continue with project importance. So first is high diabetes prevalence in Malaysia. So as I mentioned earlier, Malaysia has the 1 in 5 adult in Malaysia is having this problem, and Malaysia also has the highest prevalence of diabetes in Southeast Asia. Second is technological accessibility for the elderly. So this project addressed to the technological accessibility gaps for elderly patients who are unfamiliar with advanced technological by providing an SMS-based diabetes management system. Third is the benefit of SMS-based management system. So the SMS-based system aim to enhance patient engagement, improve the clinical outcome. Okay, so next we're going for table comparison based on benchmark paper and my project. So my benchmark paper is by Kon HS, Cho JH, Kim HS. So the title for the paper is Development of Web-based Diabetic Patient Management System using Short Message Service. So I have few aspects to differentiate between my benchmark paper and my project. So first, my study location is in Malaysia, while my benchmark paper is in Seoul, the Republic of South Korea. And then the participant is in my benchmark paper, it state it was 185 diabetic patients. So for my project, my participant is elderly patient, which from 60 to 100 year. Why I start with 60? Because 60 is the golden age in Malaysia. So the mean age for my benchmark paper is 42.4 years, while my project is 80 years. Okay, feature. The benchmark paper had blood glucose monitoring, medication dosage, meal and exercise tracking, while my project has reminder, especially reminder for medicine, blood glucose level, appointment and lifestyle recommendation. And then the setting for lifestyle recommendation, blood glucose monitoring, and patient education. So how patient education is by lifestyle recommendation. So I have 3 sub, which is the cleanliness, the diet and exercise. So what is the measured outcome? In my benchmark paper is the HbA1c test, the serum triglyceride, HDL cholesterol, while my project is the reduction in diabetes related complication, improve medication adherence and glucose monitoring, and also improve the patient education in the diabetes. User satisfaction. So in my benchmark paper, it's high satisfaction, which average score is from 3.89 out of 5. And then my project is to be determined. Okay, next we are going for the flowchart and flowchart software and hardware for the system. So this flowchart show of for the phase of agile process, which this agile process include first requirement gathering and planning for the to achieve the first project objective, and then design and development to achieve second project objective. Third and fourth is which is testing and evaluation to achieve third project objective. Okay, so for software and hardware that I'll be using for this project is, first, hardware is my laptop with minimum RAM of 8GB. And then for the software, first of all, I'll be using Visual Studio Code for the platform for my project. So my programming language is Python, this Django as my framework, MySQL is my database, and I'll be using Mohd as the SMS API. Next is the use case diagram. So, and use case description. I'll be having 20 use case description, which cover registration, authentication, and also reminder for medication, blood sugar level, lifestyle recommendation, and then also appointment. reminder. And I'll be having also for the administration part, which is edit patient profile, generate report, and also setting for SMS. Next, I'll be showing to you the system method, which I have two system method, one for admin flow and second is for the user flow, the patient flow. So for admin flow, okay, I will have, okay, so first the system will start by identify the admin, and then once it identifies the admin, it will load to dashboard. So in the dashboard, it will be have 4 menus. So first is the reminder, second is the lifestyle setting, third is appointment, and also last is the administration. And then next we'll be going for the still admin flow, which for the SMS part. So how the SMS send to the patient. So first, the SMS will identify the patient data. So once it identify, it will send a message to authenticate patient. Once the patient reply with their last 4-digit IC number, once it's successful, it will check the time for reminder. So we have 4 reminder, which is one is the medication reminder, blood sugar level reminder, appointment reminder, and lifestyle reminder. Okay, so patient flow is a bit easier because the medium for patient is just SMS, so they will receive the SMS message and they will reply to the SMS according to the category of the SMS. Okay, next, the use case description. So in this PowerPoint, I put 4 use case. First is authenticate patient. Second is the send medication send medication reminder, send blood sugar level reminder, and also send lifestyle recommendation reminder. So this is the activity diagram. The same use case I use. So this first is the authentication patient, second is the send medication reminder, third is the send blood sugar level reminder, fourth is the lifestyle recommendation reminder. Next is the sequence diagram. So the same, I use the 4 same use case. Admin interface. So for admin interface, as you guys see in the PowerPoint, okay, so first, this is the first page that the admin will see. So okay, next, this is the register page. Once the users click register, it will be back to the login page and will direct it to the login page, and once it's successful login, it will direct to the home page. So next, this is the laporan pesakit. Okay, next, this is the 4 reminder. So we have 4 reminder, as I said. This is the interface for medicine reminder. Okay, next we'll be going for the blood sugar level. Okay, next is the appointment. So for this interface and the web base is in bahasa. Also the SMS will be in bahasa. Okay, next is the gaya hidup. Okay, next, this is cadangan gaya hidup, which is the lifestyle recommendation. So like I said, I have 3: cleanliness, food, and exercise. So this is the interface for the admin to setting the lifestyle recommendation. So this is the appointment. So what is the meaning behind the green and red? Green is for those patients who attend their appointment. Red is those who does not attend their appointment. So for those who does not attend the appointment, once the admin click and the admin will see the report, it will click for the kemas kini for the system to update the next appointment. Okay, next is the administration. So we have 4 sub, which is first is add patient. So this is the interface to add the patient. So once the admin add the patient, the system will automatically send the authenticate SMS to the patient. Okay, next is the edit. Next is the general report. So once the admin choose which patient, they will come out with the report so they can print or save the report. So last is the SMS. So this SMS is for setting the SMS message. Next, we are going to the patient interface. So for patient interface is very easy, which is the SMS in their phone. So in the SMS, it will be a simple two-way communication between the system and the patient itself. So every SMS message has the instruction for the patient. So as for example, to authenticate themselves, they state in the message, they just need to reply with the last 4-digit IC number with sahkan and their last 4-digit IC number. So once they send the message, the system will automatically analyze and grant access to the patient. Right, so last is the conclusion. So addressing healthcare access and technological literacy. So the SMS-based diabetes monitoring system is specifically tailored to address critical gaps in healthcare access and technological literacy among the elderly population in Malaysia. And also by using SMS technology, the system provides timely medication reminder, blood glucose monitoring prompt, and lifestyle recommendation, improving adherence to diabetes care protocol. Lastly is the enhancing effectiveness with AI. So the integration of AI to predict optimal reminder time enhance the system effectiveness, contributing to improve health outcome and quality of life for an underserved demographic. Thank you everyone. That's all from me.